Good morning, students. So today we are going to just do a recap on the previous year questions. I'm not going into much explanation there. Our time is limited. So what we are going to do is we are just going to see the last previous year questions. Okay. So from 2020 till 2024, okay, approximately 178 questions have been asked in biochemistry. So what I'm going to do is I'm going to share this file. We have already done a previous year questions sessions. Okay. So in that we have finished everything the last 3 years once. Okay. But that time I didn't do any NEET questions. What I did was I concentrated only on the initiate questions. Okay. So this time I'm going to do all the NEET questions for the past 3 years. That is 2020, 21, 22, and 23. And then I'm also going to tell you the answers for the lastly concluded INICET May 2024. Okay. So in INICET May 2024, so the first part of the session will be we will have 58 questions which have been asked in the NEET examinations. Okay. 4 years of NEET. Okay. And then second one is INICET May 2024. In INICET May 2024, 16 questions were asked from biochemistry. In that, in metabolism, we had 2 questions. Inborn errors, we have 4 questions. Okay. Clinical chemistry or clinical biochemistry, we had 3 questions. From enzymes, 1. From genetics, 1. From vitamins and minerals, we had 1. Okay. So if you see the distribution was actually scattered. Okay. More emphasis would have been given to genetics if it was an initiate question, but then this time these fellows have not gone with genetics. Rather, they choose to go with the metabolism and the clinical biochemistry. Okay, so predominantly around 50% of the questions were from the strong biochemistry. So temperamentally, I would say the paper was moderately easy. Okay, not moderately difficult. It is moderately easy. This is what happened in May 2024 INICET. Okay, and also if we go into the patterns, we had straight away factual questions. You just know the fact, you get the answers. That was 11. So 11 out of 16 were straight away factual questions. That is very, very easy paper. Not much application was required. Okay. We have case-based questions was 3. That is also, that's quite okay. But then not bad, not good also. But it's okay, fine. Could have been more case-based question. How many image-based questions were there? Only 1. So only 1 image-based question was there. And then we also had to match the following. These are questions where you should not go wrong, children. So, okay, when there is someone who giving you a match the following question, we are not supposed to go wrong there because everybody's going to score in those areas. All right. So, if you see this, INICET May 2024, I would say this is very easy. Looking at the screen, I would say this is very easy. You should have cracked that paper. Never mind. The positive thing is most of you would have written INICET. If it comes to NEET, we have around 57,000 NEET-PG seats, including DNB. Okay, there is a seat for every one of you. Do not think about that pressure at all. Do not take that pressure at all. Do not soak yourself in pressure. There is a seat for every single one of you. Where it's up to you to decide whether you are going to, take the seat or not. Okay. So don't worry about whether I will get the seat or not. You already have a seat. That is not an issue here. Whether the seat is to your liking, whether you are going to take that seat, that is what is exactly what we need to do here. So what we are going to do here is we are going to start with the NEET questions. Okay, NEET 2020. I will start with the NEET 2020. Okay, we don't have much time, so I'm just going to go ahead and give some minimal explanation for all this. All right. If the percentage of thymine residues in DNA is 28%, what is the percentage of cytosine? You all know that Chargaff's rule says A pairs with T, C pairs with G. And the total number of A plus T is equal to C plus G. Okay, purines. Okay, adenine and total number of A plus G is equal to C plus T. Okay, This is bonding. This is total number of purines is equal to total number of pyrimidines. Okay. So what they have given you here is they have given you thymine is 28%. Thymine is 28%, which means that whatever is gonna pair with is also equal to 29%. Okay. So that is adenine. That is also 28%. Okay. So totally adenine plus this is 56%. Okay, 56%. And then what we are going to do is we are just going to find out the other pair. Okay. So what we have here is adenine plus guanine is equal to cytosine plus thymidine. Okay. So adenine pairs with thymine, cytosine pairs with guanine. Okay. So what happens is we are having total number of purines is equal to total number of pyrimidines. Okay. So 28% of thymine means we also have 28% of adenine. Okay. So that will make 56%. So the remaining is 44%. Okay. Remaining is 44%. This 44% is should be made up of C plus G. Okay. So which means that each of this is equal. No? All of them are equal, right? So it is 22% each. So the answer here would be, it will be 22%. Okay. So what you have applying here is the Chargaff rules. What you're applying here is the Chargaff's rules. Okay, so you need to understand also that Chargaff's rules is applicable only to double-stranded DNA. It is not applicable to RNA or single-stranded DNA. It is not applicable to RNA or single-stranded DNA. Right. So the next question, a patient complains of knee pain, routine investigations unremarkable, urine turns black on standing, which only means that it is a case of alkaptonuria. It is a case of alkaptonuria. When in alkaptonuria, what is the enzyme defect? It is nothing but homogeneticate oxidase. Okay. Number 3. There is also the word. Which word you need to know? Uchronosis. The word is uchronosis. Okay. Non-competitive inhibition has. See, competitive inhibition, non-competitive inhibition, there is no, you don't have any kind of, confusion. Competitive inhibition, Km will increase, Vmax remains the same. Whereas in non-competitive inhibition, Km remains the same and Vmax decreases. So this same question was again and again repeated in the recent NEET May 2024 also the same question was repeated. So here the answer is Km is normal and decreased Vmax. Yes, Tankati, correct. You are correct. Okay, fine. 2-3 years back, there is a huge uproar and every time they were keeping on asking the pellagra. Okay, so see here, female on maize as staple diet. See, whenever there is people having the corn, maize, this thing kind of staple diets, no, there are certain ingredients which will affect. Okay, so there is one chemical called as niacin. This will inhibit the vitamin B3 absorption. And there is also leucine amino acid. This will also inhibit the vitamin B3 amino absorption. So what happens is because of all these things, there is decreased vitamin B3 that leads to pellagra. So this is predominantly in corn and maize diets. That's present in the northern belt of Maharashtra, Karnataka border, those kind of regions. Okay. So here it is pellagra, diarrhea, lesions in neck due to deficiency of niacin. Deficiency of niacin. Okay. Now, next question. Replacing alanine by which amino acid will increase UV absorbance of protein at 280 nanometers. At 280 nanometers, UV absorbance is given by aromatic amino acids. So you need to find out replacing alanine with which aromatic amino acid, or they're just asking you straight away which is the aromatic amino acid here. The aromatic amino acid is tryptophan, phenylalanine, tyrosine, and tryptophan. Okay. Also, you guys have to remember that DNA also absorbs UV light at 260 nanometers. 260 nanometers. Okay, fine. Now, nitric oxide is a special product which is synthesized from L-arginine, because arginine, in the help of nitric oxide synthase, gives rise to nitric oxide. There are five cofactors needed. Please remember this. Okay, LB, heme, tetrahydrobiopterin, FMN, FAD, NADPH, all those things are needed. Five cofactors are needed for this reaction. And this nitric oxide synthase is also three types: eNOS, nNOS, iNOS. Inducible, neuronal, endothelial. Okay, so eNOS, nNOS, and iNOS. Okay, fine. So the answer will be nitric oxide. This is a NEET questions are very, very simple, straightforward questions, children. Okay, this is like going to be a cakewalk for you all. You have been preparing so long. You're all very strong. Okay, so don't worry about that. It's going to be very strong. Okay. Apple B48 is example for what? It is an example for RNA editing we have seen in the class. Okay, RNA editing means there is one big protein. This is a 100 amino acid residue protein. But then at the 48th position, we have a premature termination. Or this is otherwise called as truncation. This is always called as truncation. Now, alternate splicing is when a membrane protein can be converted into extracellular or intracellular. Or simply they will tell you an insoluble protein has been converted into a soluble protein, whatever. So that kind of scenario, you should go for alternate splicing or RNA splicing. Then ApoB 48 and ApoB 100 are very typical examples for RNA editing. You should be understanding that. Okay, that's fine. One very ridiculous question: which absorbs least water? Okay, see here. This. Actually, this belongs to this category. Okay. Okay, so this is the only one. Mucilage, hemicellulose, pectin, all are water soluble. Okay, so the only answer here is lignin is the one which is absorb least water or is not water soluble. Okay, fine. Another one time they asked the question: jams are rich in pectin. So these are the two questions so far they have asked about the chemical properties of dietary fibers. Okay, all of them comes under the classification of dietary fibers. Okay, vitamin B12 is found in very simple animal products. There is nothing for you to think about that here. Vitamin B12 is present in animal products. Okay, now enzyme which is activated by decrease in insulin glucagon ratio. All of you must understand insulin glucagon ratio is decreased means it is synonymous to decrease the insulin. So which is the one single enzyme which is activated when it is insulin is decreased and glucagon is activated or glucagon is increased? Simple, very simple. By looking at the option only, you can say three of the enzymes will be working in a similar direction. What are the three enzymes? It is glucokinase, hexokinase, glycolysis. Glycolysis is stimulated by insulin. PFK, one regulatory enzyme of glycolysis, again stimulated by insulin. So all these three fellows are. What about this fellow? Glucose 6 phosphatase. Okay, glucose 6 phosphatase is an example for gluconeogenesis enzyme. That is the enzyme which is activated in the presence of increased glucagon and decreased insulin. Now, any one of you tell me glucose 6 phosphatase is active in which state? Phosphorylated or dephosphorylated? You are not understanding. Some of you are putting wrong answer. Anything which is activated by glucagon is active in phosphorylated state. Please remember, anything which is activated by insulin is active in dephosphorylated state. I have taught you this many times in the class. Remember this, do not forget. Now so everybody is putting correctly. Okay. So insulin activated enzymes are active in dephosphorylated state. Glucagon activated enzymes are active in phosphorylated state. Okay, please remember this. Proteoglycan present in glomerular basement membrane. It's a very, very simple, straightforward question. Glomerular basement membrane is made up of two things, type 4 collagen plus heparan sulfate. Now, this contributes to the negative charges. And for this, the point is Alport syndrome. See, this is because it is contributing to the negative charges only, albumin is repelled usually. Please remember this. Albumin is repelled. Okay. See, this was the question paper where there was two questions asked from the same area. I'm not going to ask you anything. Everybody is knowing this answer because this is an example for Kesel necklace. The answer is vitamin D. Okay, fine. Which of the following binds to tyrosine kinase receptor? See, tyrosine kinase receptor. Which hormone mediates its action through tyrosine kinase receptor? It is insulin. Only insulin binds to tyrosine kinase receptor. There are many other signaling pathways. You should also read about this pathway. It is called as JAK-STAT pathway. Okay. Janus kinase. JAK-STAT means Janus kinase, STAT pathway, growth hormone, all those things you should understand everything where it is asking. But then who involves a tyrosine kinase means it's a big mechanism. Tyrosine kinase receptor is usually bound by insulin. Insulin acts via this. Okay. A 45 male paresthesias with hemoglobin 6, that means he is suffering from anemia. Okay. He is having macrocytes. So this is nothing but a megaloblastic anemia. When you put megaloblastic anemia itself, only two fellows are the candidates. One is folic acid, another one is vitamin B12. Okay. Endoscopy shows atrophic gastritis. Now you got your answer at least. Atrophic gastritis, gastrectomy, hemigastrectomy, or partial gastrectomy, everything points towards the parietal cells, and actually it also says there is a deficiency of someone called as intrinsic factor of Castle. Intrinsic factor of Castle. Okay, this is fine. Good. So the answer would be vitamin B12 deficiency. Now they have given you a pedigree chart. They are asking you what is the inheritance. See, either you answer like this. You answer like Marfan syndrome. Marfan syndrome is autosomal dominant. If you know that, it's quite clear. Okay. Otherwise, how do you decipher a pedigree chart? I have told you, you first look at the number of males and the number of females affected. Number of males affected 3, number of females affected 2. So both sexes are affected means it is autosomal. Then you look at every single generation. In every single generation, the disease is present means it is dominant. Very simple. If any one generation completely washed out, no disease, everybody is normal, then that is an autosomal recessive. That is called as skipping of generation. So in one full generation, there is no disease means it is skipping of generation, it is a recessive. But every generation, diseased fellow is there means it is a dominant. So very simple technology I have taught you in the class. Okay, you all know that this is the protocol. Also, remember, what is this? You all of you, please tell me what is this symbol means. Very good, Shweta. Very good, SS. Very good, very good. This symbol means it is a carrier state. Females are carrier. Very good, Hari Prasad. Okay. So if a carrier state is seen, you consider that person as normal only. Okay. You will not consider a carrier as a diseased person. It is a normal person. All right. Fine. Okay. So that is question number 15. Question number 16. Okay. Question number 16. So etiology of Werner syndrome with premature aging. Can anyone tell me? Can anyone tell me which is the answer here? Werner syndrome with premature aging. Werner syndrome or premature. See, the clue is premature aging. See, premature aging, everything. Aging itself because of the shortening of the DNA. Shortening of the DNA. So, this is called as the end replication problem. Whenever a replication occurs, a piece of the DNA is becoming lost. Okay, that is becoming the DNA is becoming shortened. So with every cycle of replication, the DNA becomes short. Okay. So in Werner syndrome, this shortening, okay, is even more accentuated. So the DNA becomes damaged or becomes prematurely shortened. So what happens is there is a faster cellular aging. So the answer here would be short telomere with damaged DNA and loss of helicase. So helicase activity is not able to unwind the DNA. So that is what is exactly the uh, causative factor for Werner syndrome with premature aging. Okay. In a preterm baby with respiratory syndrome, distress syndrome, which of the following lipid would be deficient? It's a very, straightforward question. You need to answer this as lecithin. Okay, you need to answer this lecithin. See, do not confuse with L by S ratio. That is a ratio. Okay, so L by S ratio will be lesser than 1.7. If they are asking you a single deficient this thing, it is actually a phospholipid. It is the phospholipid. Okay, that to what phospholipid? It is a glycerophospholipid, which is called as lecithin. Glycerophospholipid lecithin. Okay, so the answer would be dipalmityl phosphatidylcholine, otherwise called as lecithin. Okay. Okay, now you tell me one thing. Which among these following three options has antigenic activity? Let me see who can answer. Yes, very good. So cardiolipin has antigenic activity in one of the recent this thing. There is one disease which is associated with cardiolipin deficiency. It is called as Barth syndrome. It is called as Barth syndrome. Okay, so it's due to cardiolipin. Mitochondrial disorder. Yes, it is a mitochondrial because cardiolipin is found in the mitochondrial membrane. All right, fine. Okay, next question. Let me see who can answer. Which of the following is a DNA replication inhibitor? The DNA replication inhibitor, everybody knows it is 6-mercaptopurine. Okay, 6 mer. See, this is transcription inhibitor. I have taught you. Okay, actinomycin D. See, the D stands for DNA. Actually, it binds to DNA and decreases transcription. Binds to DNA and decreases transcription. Very good. So the most of the students, what they put the mistake is the actinomycin D. But then actinomycin D binds to DNA, true, but it is not a replication inhibitor. It is a what to say? It is a transcription inhibitor. Okay. The real answer for this question would be 6-mercaptopurine. 5-fluorouracil also can be considered as a, if given, is a replication inhibitor. Okay, fine. Now, next question. Which of the following is a transcription inhibitor? It's a very simple question. Which of the following is a transcription inhibitor? It is a rifampicin. Okay, you all know that. Rifampicin is straight away RNA polymerase inhibitor. Okay, so I already told you actinomycin D. Okay, I am now telling you rifampicin. There is another one, fellow. One is a transcription inhibitor. It is amanita That fellow is also a RNA polymerase inhibitor. Okay, it comes from fungus, amanita Okay, fine, good. 3-deoxyadenosine is synthetic. Okay, 3-deoxyadenosine is a synthetic inhibitor. It is not from a natural point, it is synthetic. Okay, fine, good. So with that, 19 questions in NEET 2020 children, 19 questions. Okay. You all should remember everything was a easy question only. You are to get the 19 out of 19. NEET examination, like we are not having any scope to lose in biochemistry. You have been adequately trained. You put all the questions right, you get the rank. That is very simple as. Okay. Fine. We'll go to the next one. NEET 2021. A person had a meal at 8 p.m. and his blood sugar levels at 7 a.m. on the next day is high, very high. So he is fasting. Okay, he's fasting, but still fasting glucose is high. What is the source of glucose? See the source of glucose. First 10 to 18 hours, I have told you it is glycogen. It is glycogen. Okay. And it is not coming from the muscle. Muscle glycogen breaks down only when you enter into starving. When you're fasting, the liver is a store of glycogen, so it is a hepatic glycogenolysis. So the answer is many of the fellows are putting this, many of the fellows are putting this. This is gluconeogenesis. This is not the answer. It takes over after 24 hours. Okay, 24, 26, 30. Like, okay, when the glycogenolysis ends, only the gluconeogenesis starts. Like that. Okay. Fine. So, which is responsible for corneal transparency? I have told you very much. Kerato means cornea. Kerato means cornea. Again, there is keratin sulfate type 1 and type 2. It is also present in the skin. Cornea mattum kadayadu. It is also present in the skin. Please make sure of that. Okay. A patient developed with multiple GI polyps and carcinoma with positive family history. This is nothing but the Lynch syndrome or HNPCC. Okay. Kindly tell the whole hours. What is that whole hours? I don't understand. Somebody told whole hours. What is whole hours? Okay, fine. No problem. See, HNPCC means it is a what kind of a repair it is? It is an example for mismatch repair. For nucleotide excision repair, we have xeroderma pigmentosum. That is a main disorder. Okay, for base excision repair, it is a most of you might have not known muti H associated polyposis. Harperla, this is what is given. Muti-H associated polyposis. It is called as MAP. Okay. Point mutation, you can go for sickle cell anemia. You all know examples. Okay. So everything we have got this thing. Okay. Everything we have got this thing. Okay. So the next question. This question 2 years later, it was again asked in the EAMS examination. E1, E2 and E3. What is the order of insult? Can you tell me the answer? This is the part of the enzyme pyruvate dehydrogenase complex. So which is E1, which is E2? Yes. Okay. So, yeah. E1 is pyruvate dehydrogenase. E2 is dihydrolipoyl transacetylase. Dihydrolipoyl dehydrogenase will become the E3. Okay, E3. Okay, so what will be the answer? Sorry, what will be the answer? I'm putting the arrows. Okay, like this. Pyruvate dehydrogenase, pyruvate transacetylase, and E3 is dihydrolipoyl. So the answer will be this one. Pyruvate carboxylase, somebody is putting B. That is the gluconeogenesis enzyme. Don't confuse it. We are not gluconeogenesis. We are doing the pyruvate dehydrogenase complex. Okay. So pyruvate dehydrogenase complex, dihydrolipoyl transacetylase, dihydrolipoyl dehydrogenase. These are the E1, E2, E3 enzymes. Do not make mistakes in such type of questions. Okay. Fine. Yes, pyruvate carboxylase cofactor is biotic. Okay. Good. Now, this is very one of the confusing questions for me. Okay. A girl with deteriorating night vision and lesion on extensor aspects of forearm. Okay. See, straightforward, everybody taking the phrynoderma because we know that phrynoderma is an essential fatty acid related disorder, extensor aspects of the forearm, everything. But actually, deteriorating night vision. See here, vitamin A deficiency can lead to this thing. Okay. Now, this is a disease which can lead to vitamin A deficiency. Now, in vitamin A deficiency, there is a possibility of hyperkeratosis follicularis, which is also a lesions on the extensor aspects of forearm. So both these options are found to be correct. Okay. We don't exactly know which one of this. Both of them can be given as a correct answer. Okay. That AIMS fellows or NEET-PG fellows, which they have given as a correct answer, I am not exactly sure. So if you ask me, Phrynoderma is EFA deficiency. Okay. And it can lead to lesions on the extensor because of essential fatty acids, fat soluble vitamins are also correlated. But if you ask me single best answer, I would go with this because there is this is very vitamin A deficiency is very much noted. It can go with deteriorating night vision. Vitamin A deficiency can also lead for extensor forearm. But then I am not disputing. Both of them are correct. I don't know why they have given this answer. So it's only up to them to tell which is the correct answer. We only hope that such questions don't come. Fine, no problem. A patient with tendon xanthoma, high LDL and high serum cholesterol. This is very straightforward question. He was put on lovastatin. Tendon xanthoma, that word itself must tell you it is a familial hypercholesterolemia. Now all of you type in the comment box, what is the defect here? Friedrichsen classification. Where do you see LDL receptor defect? So everybody knows that it is a LDL receptor defect. Okay, good. An alcoholic patient present with lesions as shown in that. This is called as a beefy tongue. And beefy tongue is a very characteristic feature of vitamin B12 deficiency. Vitamin B12 deficiency. In vitamin B12 deficiency, what is the history you should add? This history is nothing but a dietary history. You need to ask him if he is taking the animal products. Okay. Some fellows are thinking that whatever picture is there, pellagra is given, so they are putting the diarrhea and memory loss. Okay. Some fellows are thinking it is a diarrhea and conjunctivitis. I don't remember know why conjunctivitis. That is not conjunctivitis. In something, it is a circumcorneal congestion. That is vitamin B2 deficiency. Yeah, that is corneal congestion. It is not a conjunctivitis. Even then, in B2, we don't have diarrhea. So what these fellows are thinking is glossitis, cheilitis, other ஏதோ picture போல இருக்குன்ட்டுன்னு they are remembering something vaguely, கண்ணுலயும் ஏதோ இருக்கும், something like that, and they are putting up diarrhea and conjunctivitis. That's nothing. And I don't know. The allergy and all, in tongue allergy and all, I don't know. I am not sure how it looks like, tongue allergy. Okay, what you need to do is you need to put up the dietary history. That will be the correct answer. Okay. See again. A farmer presented with loose stools. This is diarrhea. Rashes all over. Diet history rich in maize. Very simple. Year or 2020 they targeted niacin. 2021 they are targeting niacin. See, that's why I used to tell you niacin pellagra. Everybody should read. Everybody should read. Okay. Now, fatigability. 5-year-old child. Irritability. Inability to concentrate. இதெல்லாம் வச்சு we cannot do anything. Labs revealed pancytopenia on microscopy. This is a hallmark feature. Pancytopenia is a hallmark feature for Gauchers. Okay, it's a hallmark feature for Gauchers. Okay, so this is a classic case of Gaucher syndrome. They're just asking you what is the this thing. Okay, because why? Because means bone marrow is getting Erlenmeyer flask deformity. சொல்லிருக்கேன்ல classல Erlenmeyer flask deformity. The long bones are gone. The long bones gone means the bone marrow suppression. Bone marrow suppression leads to pancytopenia. That is why you are getting pancytopenia in Gaucher's disease. Okay. A young girl came to OPD, tall, thin, with slender fingers and dislocated lens. Dislocated lensனாலே ரெண்டு தான். ஒன்னு ஹோமோசிஸ்டினியூரியா இல்லனா மார்ஃபன்ஸ். ஓ ஓகே ஓகே, நோ ப்ராப்ளம் நோ ப்ராப்ளம். இப்ப ரெண்டுத்துல எது டால் தின் ஸ்லெண்டர் ஃபிகர்ஸ்? ஓகே, எவ்ரிதிங் இஸ் what is marfanoid, everything correlating. But workup revealed cystathionine beta synthase deficiency. Very classically they have given you homocystinuria. Classical homocystinuria history கொடுத்துதான். Type 1. ஓகேவா? டைப் 1ல தான் இந்த டிஃபெக்ட் இருக்கும். சோ என்ன பண்ணணும்? cystathionine beta synthase is not there. Means cystathionine is not produced. There is no cystathionine. There is no cystathionine means there is no cysteine plus homoserine. Correct? ஏன்னா homocysteine plus serine தான் இதை கொடுக்கும். Homocysteine plus serine gives rise to cystathionine. Cystathionine இது வரும். So இப்ப இந்த இடத்துல block cystathionine இல்ல. So what we need to supplement? We need to supplement cysteine. We need to supplement cysteine. Okay. Also remember this enzyme has vitamin B6 as cofactor, PLP. So one of the times I found which vitamin can benefit homocystinuria patients. That is, if there is a vitamin B6 deficiency, this enzyme might not properly function. So you need to supplement B6. Remember this point also. A patient came with joint pain. On examination, urine turns black on standing. Very simple. Straightforward, repeat question. Same question is repeated next year also. 2020 2021 Okay. You are conducting an experiment in mitochondrial respiration. You add malate or pyruvate. Respiration is normal. Okay, malate, pyruvate, respiration normal. In the presence of pyruvate on succinate and malate, another substance is added. Respiration is blocked. Respiration is blocked. Which of the following substance is likely to be added? Can anyone tell me the answer for this question? Yeah, the answer for this question is oligomycin. Oligomycin. See, cellular respiration is based on the ADP ATP conversion. ADP ATP conversion. So basically ADP ATP conversion is done by ATP synthase. In fact, solapona, which is the indicator for respiration, cellular respiration, you need to put this one only. It's not even ATP, it is ADP, respiratory control. Okay. So this ATP synthase inhibitor, yaar, this is oligomycin. நான் ஏற்கனவே சொன்னிருக்கேன் அதுல FOF1. It is not a zero. It is a oligomycin bind பண்றதுனால it is a F0 FO subunit. It is a FO subunit. Okay. So this is what is done. Some of the fellows think that this is a uncoupler 2,4-dinitrofenol. Not bad, but still the answer is cellular respiration. Cellular respiration is based on the levels of ADP, ATP. Okay. So if respiration they're just asking you about ADP, ATP. Okay. See, if there is atractyloside in the option, then there is a confusion because it's a ATP translocase inhibitor. There is no atractyloside. We are very clear. This is oligomycin. Okay. A child with a loose stool one day loose stools, dehydration percent. The child was given ORS. So ORS, which facilitates glucose absorption via which of the following? So all of you know that. I have told the story also. It is a SGLT1. Okay. Now SGLT2 is present in the kidneys. All of you should understand. One for intestine, two for the kidneys. Okay. So everything was going well in this NEET examination. All the students were putting everything correct. All of them were becoming very happy. Most of the fellows put this question only as wrong. Okay. Otherwise, everything was happy. Then came this question. One of the very tricky question. Okay. See, there is an IT professional woman. Okay. She is online due to hectic job of 12 to 14 hours. Who has a diet which does not include fruits and vegetables. Okay. She complains of fatigue. HB9, அப்பனா என்ன அர்த்தம்? Anemia. MCV 120 femtoliters, அப்பனா என்ன அர்த்தம்? Megaloblastic anemia. ஓகேவா? நம்ம ஆளுங்க பார்த்தானுங்க ஐடி ப்ரொஃபஷனல் டயட் பத்தி ஏதோ பேசுறாங்க, மெகலோபிளாஸ்டிக் அனீமியா, எல்லாரும் போயிட்டு they all putting the vitamin B12 deficiency. But you should understand, she has a diet which does not include fruits and vegetables. அப்பனா என்ன அர்த்தம்? She is Swiggy and Zomato. She is putting and eating mostly non-veg items. When she is eating a non-veg items, can there be vitamin B12 deficiency? No. This is a case of folic acid deficiency. See, that is how they put up a question and make you commit a very simple question. Okay, this is a very, very simple question. Okay, so she is not eating green leafy vegetables. So that is the history. Folic acid is rich in fruits, green leafy vegetables. So that also, that kind also you can answer. Okay, so which is dietary deficient. She is deficient in green leafy vegetables. So this is the answer. Okay, fine. So with that, I think we are completing NEET 2021. We are going for NEET 2022. Update parangla, you will understand, you will get the feel of the questions. A child with anemia thrombocytopenia, which is nothing but pancytopenia, also complains of bony pain. You know what is that? Even more history, crumpled tissue paper appearance. Very simple. This is a case straightforward history of Gauchers. So the answer would be glucocerebrosidase. What is this? They have given you an image-based question. It is a white hot spots. Why is white hot spots present? Very, very simple. White hot spots is due to deficiency of vitamin A. Very easy, no? Okay. They are giving you which of the following activities can be estimated in RBC to diagnose vitamin deficiency? You know what? You get selective blindness. You will see RBC, you will see vitamin deficiency. Straight away, everybody will remember the transketolase. So transketolase answer like that. But then they are not asking you vitamin B1. This time they are asking you vitamin B2. The marker for vitamin B2 deficiency is glutathione reductase. This is for vitamin B1. This is for vitamin B1. Okay, so very careful, be very careful. Okay, now this is with B3 pathway. Okay, this is B3 pathway, but then the marker is not this. It is urine xanthurenic acid. Okay, this is the enzyme. This is the enzyme. Okay, fine, good. Next question, DNA organization. DNA packing is done by which of the following proteins? Very simple, histone, histone H1, H2A, H2B, H3, H4. Okay, but this is histones. Okay. A series of redox couple arranged in ascending order in inner mitochondrial membrane of ETC. There are 4 complexes. Complex 4 inhibitor. See how easily they can ask you questions. Okay. Complex 4 inhibitors in a H2S, carbon monoxide, cyanide. Okay. So that is nothing you need to think. You straight away put the answer. Okay. Now again, very nice, very simple question. Case-based, these are called as case-based MCQs. Patient from Mediterranean went to Africa, developed a history of malaria. He was treated with primaquine, later develops hemolytic anemia, which is the enzyme defect. This enzyme is nothing but G6PD. Very classic history. He went to Africa, malaria, okay. Primaquine puts on oxidative stress. Now, whenever there is an oxidative stress, there is a peroxide buildup. So, who has to clear this peroxide? Glutathione peroxidase. Now, this glutathione peroxidase needs NADPH. Okay, NADPH. That comes from this step, HMP step. Okay, so when there is no G6PD, no NADPH, no glutathione peroxidase activation, no glutathione peroxidase, peroxides build up, they hit and break the RBCs, leading to hemolysis and hemolytic anemia. All right. Single mutation in a base pair, changing it from protein coding to termination codon, stop codon, is known as missense, nonsense, stop mutation, and silent mutation. It is a nonsense mutation. Okay, nonsense mutation. Again, this very weird. Stop mutation may be there, maybe we do not know, maybe. But then the apt word is nonsense mutation only. Kynureninase is having a cofactor PLP. Okay, but kynureninase comes in the vitamin B3 synthesis pathway. That is a tryptophan metabolism. Okay, so that also you should remember. Fine. Which of the following helps in the transport of fatty acids across the inner mitochondrial membrane? Very straightforward. Carnitine is the transporter. All of you remember that four fellows, right? Okay. Remember, yes or no? What? Carnitine. You don't remember carnitine? Carnitine. Acyl carnitine, carnitine. Okay. Cat. Do you remember this fellow? Carnitine, acyl carnitine translocase transporter. Okay, fine. And then you get this CPT1 and his brother CPT2. All these fellows are involved in the transport of fatty acids in the inner mitochondrial, across the inner mitochondrial membrane. Okay, this is, we are talking about beta fatty acid oxidation. Remember, a 16-year-old boy presented with pain in the muscles. He also has during exercise, அப்ப என்ன அர்த்தம்? Exercise intolerance பத்தி சொல்றாங்க. He also has a discolored urine. What is the enzyme defect? See, this is a first இது ஒரு case-based question. McArdle's disease. McArdle's diseaseல என்ன? Muscle glycogen phosphorylase. That is nothing but myophospholase. Okay. So see here, so far 42 questions out of 3 NEET examinations. Okay, what? NEET examination. அப்ப கட் பண்ணா எவ்வளவு வருது? 1, 12, 14 questions averagely per paper they are asking you in biochemistry. If I am telling you right, 14 out of 14 is the real capability of students who have attended biochemistry in the ADRPLEXUS. Because biochemistry is not a tough subject. It is an easy subject for you. Okay, everybody should be very confident while attending the biochemistry. I am giving you guarantee. If you are not able to attend that question, many of the fellows are not able to attend that question. Okay, so you don't know means you just don't get panic. Definitely, many of the fellows, you only have to decide two things: whether to take a risk and attend that question or leave it. If it is a number-based question, leave it. If you don't know numbers, leave that question. Okay, if you don't know scientists, leave that question. Don't take chances in those two questions. Remaining questions, try and apply, rule out whatever you want to do. Okay. So, NEET-PG, March 2023. A middle-aged person, upper motor neuron palsy, sensory neuropathy, anemia. Everything points towards one thing. It is a subacute combined degeneration of the cord. That is nothing but a vitamin B12 deficiency. Okay. Now, this was the question which got many of the fellows running. This question, very important. See here, there is a 5-year-old female, easily fatigued. The child was very hypoglycemic. எல்லாருமே okay தான் அப்படின்னு பார்த்தானுங்க. In between meals, but that was after food. Once you give food, it was so that means it is having a fasting hypoglycemia. Okay, liver biopsy negative for glycogen. Now, this is the problem. Many people did not see this. Fasting hypoglycemia, they jump into conclusions. It's either Her's disease or Von Gierke's disease. But liver biopsy is negative for glycogen. What is the probable defect? See here. Now, most commonly answered was glucose 6-phosphatase, Von Gierke disease, but also wrong. Because in Von Gierke's disease, you can see glycogen. That is only the enzyme defect. They are telling there is zero glycogen, which means that glycogen has not been synthesized at all. This is a classic case of glycogen synthesis defect, which is called as type 0 glycogen storage disorder. The correct answer is this, option D. Very good, very good, very good. Okay, fine. So everybody should answer this question. Mostly these fellows all went for Von Gierke, gone. Von Gierke, gone. Okay. Child had fatigue post-exercise. Okay. Serum lactate and glucose levels low. Okay. So due to what? Now this is very simple. Exercise intolerance. Straight away you'll go for McArdle's disease. Now if you see NEET-PG March 2023, 2 questions have come from glycogen storage disorder. Single area, high yield area, they have made it. Okay. Now, one female complaints of reddish scaly lesions, pustular in perioral and perianal region, also complains of diarrhea with delayed wound healing. Which mineral is deficient? Today I will tell you one important point. These NEET fellows or NBE fellows or AIMS fellows, whoever, they have a very high affinity for zinc. They are very, very, notorious for zinc. See, zinc is needed for gonadal, okay, sperm development and all these things, for taste, for insulin structure, stabilization, okay. And it also prevents diarrhea. That is what is the history given here. That is why zinc syrups are given to children. I have told you this in class. Okay. And if this zinc defect is there, then it leads to acrodermatitis enteropathica. Okay. So skin disorders also, cell differentiation also. So all these things you should remember. Okay. Zinc is very affinity to these fellows. Okay. What is the defect in scurvy? This is vitamin A. Follicular hyperkeratosis, clotting factor inhibition, low calcium illa. It is a straightforward impaired collagen synthesis. Can anyone tell me for which for which enzyme vitamin C is needed in collagen? Let me see if you are telling me. Excellent, excellent. Hydroxylation, prolyl hydroxylase and lysyl hydroxylase. See, there is another one enzyme, lysyl oxidase, that is copper. That is copper. Very good, very good, excellent. This is again a repeat question. RDS caused by deficiency of lecithin. Okay. So see here, in the last 3-4 years, this question has again come. Second time. Okay. Now, he is alcoholic for many years. What is the expected finding in this patient? See, what is there? This is all I don't know what kind of a question. Okay. See, in alcoholic, lactic acid will be increased. Okay. Uric acid will be increased. Ketone bodies will be increased. Okay. Triglyceride and fatty liver now increased. Okay. Which will be decreased? Glucose will be decreased. Okay. So there the answer is it is high uric acid. So gout, nothing but gout manifestations. Okay. So you can why? Because of alcohol, there is increased lactic acid. Now, lactic acid decreases the uric acid excretion. That is the reason why you have a gout. Okay. For the third time, you are getting the same question. Dark colored urine on standing, it is alkaptonuria. It is alkaptonuria. Again, for the fourth time, you are getting this question. Diarrhea, dermatitis, dementia, it is niacin deficiency. Okay. Now, this is another one question where many of the fellows gone wrong. A child with cherry red spots in macula. Most of the students remember that cherry red spots is present in Niemann-Pick. It is present in Tay Sachs and it is also present. Okay, fine. Now, there, the history was there is no hepatosplenomegaly. There is no hepatosplenomegaly. Okay. What is, yes, H plus H minus H. Okay. So, in all the sphingolipidosis, Harlerல வராது Harler mucopolysaccharidosis அதையும் இங்க கொண்டு வரீங்க வவுச்சர்லயும் வந்து there is hepatosplenomegaly Niemann-Pickலயும் there is hepatosplenomegaly Sandoz again the brother of Tay-Sachs அதிலயும் HSM present see everywhere HSM is present the only disease where there is no HSM is Tay-Sachs okay there is no HSM is Tay-Sachs so this was the question. Again, our question, other students went wrong. Okay, fine. So you need to remember this. Okay, this only the competition between these three. This is nowhere connected. This is MPS. Okay, va? Fine. அதிலே இருந்தா கூட அப்பயும் ஹெப்படோஸ்பிளினோமெகாலி உண்டு ஹர்லர்ல ஓகேவா நோ ஹெப்படோஸ்பிளினோமெகாலி தான் கொஸ்டின் a person with dermatitis alopecia ரெண்டுமே கிளாசிக்கல் ஃபீச்சர்ஸ் பாருங்க வெரி சிம்பிள் இட் இஸ் a biotin deficiency hair fall history of raw white eggs is avidin. Okay, what deficiency would be causing this? It's a biotin. Okay. Now a child is with anemia. It is not responding to conventional treatments. It is not responding to conventional treatments. Bone marrow biopsy picture as below. What is the enzyme deficiency? இங்க பாரு இதுதான் என்னது? What is this? What is this? What is this? Sorry. What is this appearance? Crumpled tissue paper appearance, which means what is this disease? Goucher. Bone marrow problem. Bone marrow problem இருக்கிறதுனால, okay, what is the defect? The defect is beta glucocerebrosidase. Now, if you see, again, you will understand Goucher's is a very, very important area. Okay, again and again and again question. Okay, a people in a village presenting with paralysis and crippling. A particular crop is used as a staple diet. Which of the following would help? Which of the following would help? What is the answer here? Everybody putting this as the answer. Tappu. Particular crop as a staple diet they have given you only because of you will think that maize or corn and you will put vitamin D. No. This is a case of lathyrism. And lathyrism can be caused in SPM by this chemical BOAA. In the biochemistry, lathyrism is caused by lysyl oxidase or collagen defect. So it's either copper or vitamin C. Okay, so the answer here is vitamin D. This is a wrong answer. Vitamin C is the correct answer. Boa. Okay. Again, the same question coming. Low insulin. Because copper is not given in the option. If copper is given, that will be the better option than the vitamin C. Now we have to understand this question as a collagen disorder, and then what is involved in the collagen? Vitamin C will help for collagen. That is why we are giving the collagen. Okay, ma? So that is why we are giving the vitamin C. Okay. Low insulin glucagon ratio. அப்பனா என்ன அர்த்தம்? Decrease the insulin. Increase the glucagon. பாருங்க, this is the second time you are getting this question. Which is stimulated? Which is the stimulated? You all know insulin, golden words. Which is the golden word of biochemistry? Insulin inhibits lipolysis. Insulin inhibits lipolysis. That is the golden word. So lipolysis, hormone sensitive lipase. Hormone sensitive lipase. Yeah, sir, the lipoprotein lipase தான இருக்கு, அதுவும் தான lipolysis பண்ணுது. You cannot ask like the base of hormones. We are speaking about the hormones. So insulin glucagon சம்பந்தப்பட்ட lipase எது? It is a hormone sensitive lipase. Okay, it is a hormone sensitive lipase. Fine. Very simple. What is this? What is this? This is what kind of a disease? Pellagram. ஐயோ, பெல்லகரா எல்லாத்துக்கும் பெல்லகரா போடக்கூடாதுப்பா. இட் இஸ் a rickets. Why everybody is obsessed about pellagra? You need to be obsessed about pellagra, but then in a good way. Okay, don't be in a bad way obsessed. This is a rickets. Very simple. It's vitamin D deficiency. Adeno Prabhudeva Mari. Jinu Varam, welcome. Very good. Hey, if you see NEET-PG 2023, come here. Let me see. How I will come. Where is this NEET-PG starting? Okay. See here. One question, vitamins. Okay. Two question, minerals. Third question, vitamins. Fourth question, vitamins. Fifth question, vitamins. Sixth question, vitamins. இங்க பாருங்களேன். Seventh question, vitamins. NEET-PG 2023. இப்பவே we are in the seventh question, vitamins and minerals. You try to understand the focus, which is the important topic. Okay, va? History of polished rice intake. எல்லாருக்கும் தெரியும். Polished rice நாலே which vitamin? It is a vitamin B1. And vitamin B1 ஓட marker என்ன? It is a transketolase. Okay, fine. See, vitamins and minerals லேந்து 7 questions கேட்டிருக்காங்க. Glycogen storage disorder லேந்து 2 question. இந்த sphingolipidosis லேந்து இங்க ஒரு 3. பாருங்க, see the topics. You all will know. Okay, fine. Okay, now this is INICET papers. INICET papers, last time itself I have discussed you. Now I am not going to discuss that again. But I am going to, what is this? Why this one is opened? Okay. Now I am going to just discuss the lastly happened INICET. That alone I will put. INICET PG May 2024. I will put the answers. Already your time I am taken 8 minutes extra. No problem. இது மட்டும் இப்ப recent topics I will explain. Congenital lactic acidosis is due to see NEET-PG. I have finished 58 questions. Sorry, I will take 1 minute time. Now you type in the message. All of you type in the message 5 most important topics you think most important for NEET examination. Type what you all understand. High yield areas. If you are going for NEET-PG examination, just type 5 topics. What you feel important. I will also write. Very good. இதுவும் IEM தான். That's all. இங்க பாரு. 1 vitamin mineral, 2 GSD, 3 sphingolipidosis, 4 glucose metabolism, 5 IEM, 6 GAGs, 7 ETC, 8 insulin glucose. இவ்வளவுதான் பாரு. 4 வருஷம் 3 வருஷம் பேப்பர் நீ பார்த்து 4 இயர்ஸ் பேப்பர் நீட் 2020 21 22 23 8 டாபிக்ஸ் கொண்டு வந்து நிறுத்திட்டேன் பாரு. இவ்வளவு படிச்சா போதும். திஸ் இஸ் த ஹை yield ஏரியா. ஓகேவா? நீட் எக்ஸாமினேஷனுக்கு இதை விட உங்களுக்கு ஈஸியா இன்னும் எப்படி வந்து சொல்றதுன்னு எனக்கு புரியவே இல்லை. Now I'm just finishing with INICET NEET-PG 2024 and I will take a break. Okay, break இல்ல, I will finish the class. Okay, congenital lactic acidosis is because of the defect in pyruvate dehydrogenase. ஆமாம், IEM GAG-னா inborn error of metabolism. அதுதான் டைரோசினீமியா, phenylketonuria, அப்புறம் அல்கேப்டோனூரியா, இதெல்லாம். GAG-னா ஹெப்பாரன் சல்ஃபேட்டு, அப்புறம் அந்த கெரட்டன் சல்ஃபேட்டு, இதெல்லாம். ஓகேவா? கர்லரு கிர்லரு. Fine, Aaron Wilson. Good. So congenital, why? See, pyruvate dehydrogenase is not there. Pyruvate cannot be converted to acetyl-CoA. So all the pyruvate will be converted by what? LDH into lactate. So that will be the answer. Okay. Which is not a product of heme catabolism. See here, this is correct. Biliverdin is correct. Carbon monoxide is also released. Aminolevulinic acid, ALA, is not in the heme catabolism. It is in the heme synthesis. See, that is the first step. ALA synthase. Correct? Heme synthesis. So that will be the answer. ஐயப்பா, எத்தனை வாட்டி தான் இதை கேட்பானுங்கன்னு தெரியல. சி, இங்க பாருங்க, இதுல டிகிரீஸ்டு KM, இதுல என்னாச்சு? டிகிரீஸ்டு Vmax. So which is the answer? A is competitive and B is non-competitive. And okay, yes, don't worry. All the 178 questions, this file, this PDF you will get. Don't worry, Nandini. Okay, fine. So, competitive, non-competitive, only one image-based question in this time INICET. How lucky you fellows are. That too very easy question. Very easy. Match the following. We will see match the following. Cory's disease. சரி, அதை கொடுங்க, ஈஸியா பண்ணலாம். மெக்கார்டன்ஸ் எக்ஸசைஸ் இன்டாலரன்ஸ். வாங்கிருக்கி ஹைப்போகிளைசீமியா வித் லாக்டிக் ஆசிட். இது ரெண்டும் வச்சே நம்ம ஆன்சர் கண்டுபிடிக்கலாமா? 2க்கு C, 4க்கு D. அது எங்க இருக்குதுன்னு பாருங்க. 2க்கு C, 4க்கு D. அப்ப வெரி ஈஸி. இது ரெண்டுத்தையும் அச்சிடலாம். Now we will check with 1 and 3. Okay, so 1 is 4 is வந்து branch structure in liver biopsy இல்ல accumulation of glycogen. Core is, what is the mnemonic? CDAB. Core is na debranching enzyme இல்ல. Anderson na branching enzyme is not there. So அப்ப answer என்ன? Core is க்கு இதுதான். So அப்ப 1A, 2C, 3B, 4D. Okay, fine. Pompis is accumulation. Yeah, Pompis is accumulation of glycogen in the heart lysosomes. Fine. Hard up, which gene defect causes familial hypercholesterolemia? A familial hypercholesterolemia also one topic. High yield topic you add that LDL receptor, familial hypercholesterolemia. Okay, அது add பண்ணிக்கலாமா நம்மளோட லிஸ்ட்ல? எங்க அந்த லிஸ்ட்? இதுல 9 ஃபெமிலியல் ஹைப்பர் கொலஸ்ட்ராலிமியா அதை கூட கேட்டிருக்காங்க ரெண்டு பேர். ஓகே. A male with hyperpigmentation, Tanner stage 5, presents with hypertension and precocious puberty. The causative defect is, see, this is exactly why I put you or tell you a mnemonic. Whenever I taught the class, I used to tell you a mnemonic. Correct? ஞாபகம் வச்சிருக்கீங்களா இல்லையான்னு தெரியல எனக்கு. You need to find out increased aldo, increased testo. Okay? Which is, we will write 21, 11, 17, 17. Okay. So here it is 2, 1. It is 1, 1. It is 1, 7. It is 1, 7. Okay. In this case, he is having precocious puberty, that is because of the increase in testosterone. He is also having hypertension, that is because of the increased aldosterone. So now we will see which condition will give both. Okay. Did you all understand? Fine. You should very simple. Okay. But if you don't know this, then you have to apply your concepts. You need to remember the entire pathway. Okay. I have taught you this method. Whether you guys remember or not, I don't know. Do you all remember? Yes or no? I have taught you how to decode this. Yes or no? Yes. Fine. Okay, no problem. Fine. Which is not a amino acid derived neurotransmitter. See here, dopamine comes from tyrosine. Serotonin comes from tryptophan. Where is GABA? GABA also comes from the, yeah, BB rose. Yes. GABA comes from which amino acid? Can anyone tell me? Very good. Comes from glutamine. Glutamate, glutamine, what? Okay, fine, no problem. So the answer is creatine. See, creatine is not a amino acid derived one. Thought but can revise. Revise in revise. Okay, I will finish the class. I will tell you one more time. In this initiate May 2000, once again tell the table. சரிப்பா ஒன்னும் பிரச்சனை இல்லை, நோ ப்ராப்ளம். இங்க பாருங்க, இப்படி ஒரு டேபிள் போடுங்க. ஒண்ணுத்துல இன்க்ரீஸ்டு ஆல்டோஸ்டிரான், இன்க்ரீஸ்டு டெஸ்டோஸ்டிரான். ஓகேவா? only 3 arginine இல்லம்மா, இது glutamine. Okay, only 3 enzymes are very important. One is 21 hydroxylase, another is 11 hydroxylase, another is 17 hydroxylase. Okay, so what you should write is, you should split these numbers and write like this: 2, 1, 1, 1, 1, 7. Okay, another is also 3 beta hydroxy. So that also you can write 0, 3 like this. Now what you should do is, you should strike out all the numbers other than 1. Okay, wherever 1 is there, you will put increased symbol. That's all. See, whenever they are giving history of hypertension, it means that there is increased aldosterone. Whenever they are giving history of precocious puberty in a male, or there is a history of gender confusion, ambiguous genitalia in a female, okay, that is a testosterone. Okay, so you just look at the case history, you find out what is the history given, you find out whether you are looking for this thing. Gamma amino acid, but creatine is not a neurotransmitter, right? Creatine is going for the muscle, it's a high energy compound. Is that okay? Fine. Right. So wherever it is testosterone is increased or aldosterone is increased, that you should put an answer into the question. Fine. Good. What is this? pH is 7.34. That means it is a acidosis. It is a acidosis. Okay, appa ida first achiri. And whether it is a anion gap, they are asking. Okay, it is not a respiratory acidosis. It is not a respiratory acidosis because the HCO3 is not quite down. Okay, what we are looking at is a metabolic acidosis. Okay, and what is anion gap? Strictly speaking, you should take only sodium minus chloride and bicarb. Okay, so sodium is 135 minus 93 plus 20. So that will be 93, 23 now, 103, 130. 135 minus 113. What is this? 135 minus 130, 22. 22 na usual normal anion gap 10 to 15 or 10 to 14 தான் இருக்கும் சில நேரத்தில் புக்ஸ்ல. 22 na it is high anion gap, high anion gap metabolic acidosis. Very good. Again they asked one question. Okay, this time the pH is 7.5. Okay, okay, bicarbonate is usually bicarbonate is 22 to 28. Okay, this is 35 to 45. Can you tell me the answer? What is the answer here? Normal pH, normal pH you can keep 7.35 to 7.45. It is a compensated, yeah, it is a compensated disorder. It is a compensated metabolic alkalosis. It is a compensated metabolic alkalosis. Okay, because the PCO2 is trying to increase. Okay, the primary disorder is a metabolic alkalosis. The PCO2 is trying to increase to compensate the metabolic disorder. If the pH has come back to normal, it is fully compensated. Okay, if it is not coming back to normal, it is a partially compensated metabolic alkalosis. Fine. Okay. Which of the following is not associated with post-transcriptional modification? I will tell you. Endonuclease cleavage is called as a splicing, so it is there. 5' capping and methylation. This is the same because it is a 7-methyl-guanosine cap. Okay, so all these three are gone. All these three are post-transcriptional modification. Glycosylation is the answer because it is a post-translational modification. Translation, I would have given you a table in your workbook. Please refer to that table. Okay, it is a post-translational modification. Another question, again they have put the question. Which of the following mineral deficiency is associated with this sexual maturation defect and hypogonadism? See, I already told you these fellows have an obsession towards zinc. This was the question majority of the students could not answer, but if you are really common sense, if you applied it, you would have answered this question. Which type of mutation results in the reversal to the wild type? You know what is the meaning of the word wild? The word la paatha tension aiduvanga. Wild na normal phenotype. Okay. See, there was a mutant. Okay, there was a mutant. See, there are two types of reversals. One is called as a suppressor mutation. Another one is a back mutation. In both these types, a mutation has occurred, but a mutant genotype was there, but then it will come back to the normal genotype. அதாவது மியூட்டேஷனால மியூட்டன்ட் ஜீனோடைப் ஆனா நார்மல் ஜீனோடைப்க்கு வந்துடும். ஒன்னு நடந்த மியூட்டேஷன் சப்ரஸர் ஆயிடலாம். That is called as a suppressor mutation. Another one is that amino acid whichever was changed will be replaced to the original amino acid. This is called as a back mutation. So they are just asking how is this possible? How is this possible? If you see, all these three options mean the same thing. See, frame shift means it is either addition or deletion, and you all know that all these are lethal. Okay, if you want, you can eliminate all these three. The only possible is there is another one mutation coming and either suppressing the originally happened mutation or converting that. இப்போ உதாரணத்துக்கு glycine or glutamine is converted to valine. அப்படின்ட்டு வச்சுக்கோங்க. Either this effect is suppressed or there is another one mutation coming and converting the valine back to glutamine. This is called as a back mutation. Okay, so either of this thing, but whatever happens have to happen in the tRNA. So there is a mutation of the tRNA. tRNA ஏன் tRNAக்கு மேல ஒரு அமினோ ஆசிட் தூக்கின்னு வரும் பாத்தீங்க, 3 அமினோ ஆசிட் அக்செப்டர் ஆம்ல அங்கதான் சேஞ்ச் நடக்கும். So this is a tricky question, but even if you didn't know this question also, this is the question which will help you get ranked. Okay, that is how it is. Which tool is preferred for metabolic screening in children? Okay, stand-up mass spectrometry. Is genetics important for NEET-PG? Genetics very rarely, very rarely only you will get a question. If at all that comes also, it will not be like this kind. It will be very easy. So don't worry about genetics. Yeah, tandem mass spectrometry. Somebody is writing genetic testing. No, genetic testing and all is not for screening purpose. It is for confirmation. First, we will run the tandem mass spectrometry. We will identify which is the disease present. Okay, then we will confirm it using the gene testing. Okay, fine. Yeah, even if they ask what is the Best test you should go for tandem mass only. Screening means there is only one thing we will use, that is called as a tandem mass spectrometry. Okay, fine, fine. Fish is used to detect all of the following except. Okay. See, fish can be used to detect translocation. All of you know that. Okay. One gene length. See, what is this? This 8, 14, 9, 22, all those things. Okay. And it can detect the micro deletion or gene amplification. That also you know. What it cannot detect is point mutation, because only if you are searching for a known disorder, the fish can be useful. An unknown mutation you can never detect using the fish. ரெண்டாவது, fish will use only the chromosomal to see the chromosome structures to see the translocation or amplification or deletion. Point mutation is predominantly you will check for in the gene sequencing and all those things. Okay, that is also the answer. Okay, in folate deficiency, which is the false statement, we will see. Purine and pyrimidine synthesis is affected is correct, because thymidylate synthase, that step. Okay, you all know that. B12 is also recommended along with folate. That also you know, because B12 is needed. Otherwise, folate trap and everything will be there. There is high homocysteine and normal methylmalonic acid levels. That is also correct. See, homocysteine increase means it can be B12 or folic acid. But in folic acid deficiency, methylmalonic acid levels normal. In B12 deficiency, methylmalonic acid levels also high. Okay. So that is also correct. So which is the false statement? The false statement is there is no hemolytic anemia. So the answer for this question is in folate deficiency, you will not get hemolytic anemia. Okay, that is the answer. Finally, Korsakoff psychosis, all are true except. Okay. Amnesia is present, confabulation is present. Okay, so whichever option is having 1 and 2, we should strike. Now we should only go for which is not there. Amnesia is present, so 1, this is also gone. By simple ruling out only, we can take this, or there is GOVA, pneumonia, global confusion, ophthalmoplegia, ataxia. See, this can be a neuropathy symptom. These are all classical features of Wernicke encephalopathy. So answer would be 3 and 4, because both of them come under Wernicke encephalopathy. Okay, so is that all clear? Fine. Everybody, are you all feeling confident now? I will send this PDF. I'll put this PDF. Don't worry about this. Okay. So that will finish. That will do the class. So totally 178 questions in biochemistry. Today I have discussed with you 58 from NEET plus 16 from the last NEET. That will be 74 questions. Okay. So I hope I wish you all very best. Do not worry about anything. Okay, you will all do well. Don't worry about that. Okay, you cannot solve a question. No one else can start any question. Okay, question number 174. Any doubt is that you remain. Otherwise, you can leave the class. Do well. All the best. I just need to. Yeah, I just need you all to send me a message that what is your rank. That's all. Nothing else is needed. Everybody has a seat. Whether you like it or not, you decide. Thank you, ma. God bless you. 174. You want an explanation? 174. Thank you. Thank you. Thank you, dears. 174 வந்து frame shiftனா என்னம்மா? Frame shiftனா you either add a gene or delete a gene. Okay, frame shiftனா add a gene or delete a gene. Okay, so that is what is given in all the 3 options. So it's both basically all the 3 options are the same. All right, that's fine. Good. Thank you. Thank you. Thank you. Thank you so much, friends. Thank you. You want that? Fine. Okay, no problem. See here. Once you started fasting, first 10 to 18 hours, it is glycogenolysis. Okay. Once the 24 hours is crossed, gluconeogenesis. That happens for 2 days, 24 hours to 72 hours. Okay. Uh, around the, sorry, 48 hours. 48 hours to 72 hours, we start breaking fatty acid breakdown. Greater than 72 hours, protein breakdown. That is a brief, I can tell you. Okay. Actually, this is from 12 hours itself, it will start. It will peak around this hours. Okay. So that is, yeah, okay, fine. Even if you are not writing any set, you can type NEET-PG. Don't worry about that. Okay. From where ketone body synthesis occurs? Ketone body synthesis occurs in the liver, but the liver cannot 169 wise. Okay, wait 1 minute, wait. Liver cannot utilize the ketone body because of the thiophorase defect. Okay. Brain only uses ketone bodies. Synthesis, liver, ketone bodies. High yield topics வேணுமா வெயிட் பண்ணுங்க அது எங்க எழுதணும் தெரியல 169 கொஸ்டின் வேற ஒருத்தர் கேட்கறாங்க வெயிட் பண்ணுங்க 169 க்கு கிரியாட்டின் மா ஆன்சர் கிரியாட்டின் இஸ் தி ஆன்சர் ஓகே high yield topics right this is high yield topics. At which time ketone body synthesis provide energy? When you are fasting for more than 3 days. One ketone body, if you break down, you will get 19.5 ATPs. After 3 days of complete fasting, you will start breaking down fatty acids. Fatty acids will break down to provide ketones. Is that okay, Tangati? Okay. What topic? What topic I wanted to add? Familial hypercholesterolemia. Vitamins and minerals இருக்கு GST இருக்கு sphingomatosis இருக்கு no I don't remember that. Yeah okay. No I don't remember. Okay, leave it no problem. If I remember I will tell you, don't worry about that. Fine. Okay friends, thank you so much. Yeah, bye. I'll see you. Acidosis and alkalosis and anion gap. சிம்பிளா ஒன்னு சொல்றேன் பாரு, ஞாபகம் வச்சுக்க. இங்க பாரு, இந்த பேஜ்ல எழுதுறேன் பாரு. எப்பயுமே இந்த மூணுத்த மட்டும் ஞாபகம் வச்சுக்கோங்க. ஓகே, if pH acidic or alkaline, first you should understand that. Okay, then if it is acidic, it can be metabolic or respiratory. If it is alkalosis, it can be metabolic or respiratory. Okay, if it is acidic pH, bicarbonate will be down. If it is respiratory, PCO2 will be increased. In alkalosis, because of this, HCO3 will be increased. If in respiratory, this will be this all. Okay, fine. If you want to do compensation, compensation always occurs in the same direction. Compensation always occurs in the same direction. Okay, if this is there, this should be this. This should be this. This should be this. This should be this. That's all. Okay, va? Difference between type 1 and type 2. Type 1 familial, type 1 is because of LDL receptor. Type 2 is because of increased ApoB production. So all that LDL, VLDL, everything will be increased. Okay. Thank you. Difference between metabolic compensation and respiratory compensation. That you cannot differentiate only by using the clinical history which is given, so that you will identify the primary disorder. Then you will find out which is the compensation which is occurring. Is that okay? Okay, fine. I will send. Don't worry. Bye. Thank you for